The period of adolescence and young adulthood is a transformative phase filled with exploration and self-discovery. Yet within this phase lies a delicate balance where physical, emotional, and psychological change unfolds, which can change their paths in unexpected ways. Some adolescents find themselves drawn to risky behaviors, exposing them to hidden threats such as HIV and AIDS.
We want people to understand that fighting HIV begins with you. And we have had opportunities to engage different population groups. One population group that has been hard to find and very difficult are the adolescents and young persons.
Startling statistics from the United Nations Children's Funds, UNICEF, reveals that in 2022 alone, approximately 480,000 young people between ages 10 to 24 were newly infected with HIV, of whom 140,000 were adolescents between ages 10 and 19. These statistics underscores the significance of prioritizing adolescents and young adult as a vulnerable group. Hence, there is an urgent need for targeted interventions, comprehensive sexual reproductive health education, accessible healthcare services, and socio-economical empowerment to address the concerning rise in HIV infections among the youth. In 2016, member states of the United Nations adopted the Political Declaration document to address the challenges posed by HIV and AIDS towards achieving the goal of ending the epidemic as a public health threat by 2030. Some commitments and key focus areas specifically tailored to adolescents and young adults in this landmark documents include ensuring comprehensive access to sexual education, strengthening prevention efforts, including promoting the use of condom, harm reduction strategies for drug use, and promoting behavior change through peer education and community-based interventions. These commitments highlights the importance of addressing the specific needs and vulnerabilities of adolescents and young adult within the context of the HIV response. However, it is essential to consider who holds these member states accountable for fulfilling these commitments and how the successes are measured.
Uproot itself is accountability mechanism. So a scorecard is utilized to score country performance in terms of HIV response for adolescents and young people across different elements. We have laws and policies, we have partnership, we have leadership, we have beneficiaries, and we also have participation.
After the 2016 Political Declaration on AIDS, we wanted to ensure that we are able to give tools to youth-led organizations at country level to monitor those commitments and report it in a way that it makes sense. And, they also can use that to go back to the government that, oh, we did this, we found out these are some of these gaps. And these are some of the things we feel that should go into a all government priority to address. That was what gave birth to Uproot. That was designed by the Pact.
To achieve the goals of the Uproot agenda, a community-driven monitoring tool facilitated and implemented by young people, serving as a means to assess the strides made by countries in their pursuit to eradicate AIDS by the year 2030 was developed. The inaugural phase of this initiative spanned from 2017 till 2020. In 2022, the Uproot Project, in a collaborative effort with Y+GLOBAL and support from UNAIDS, implemented the Scorecard 2.0.
For this phase, we are working with 8 countries, Nigeria, Zambia, Cameroon, Kazakhstan, Panama, India, Vietnam, and Indonesia. And we are scaling up. We are doing some re-evaluations from those that had implemented in 2017. Doing a re-evaluation and also supporting these youth-led organizations to develop an advocacy strategy that they can use in addressing those issues that were identified in the scorecard, because it's a scorecard. The Uproot gives birth to what you call a scorecard.
In Nigeria, the scorecard assessment showcases remarkable progress in the 5 key thematic indicators. However, there are challenges. While commendable strides have been achieved in the implementation of laws and policies, a focused effort is required, particularly in advocacy for service providers and law enforcement agencies.
For laws and policy, Nigeria is doing well. We just have some little gray areas that we need to just improve. Service provider lack of knowledge or information comes from different perspectives. Are they trained as a skilled health practitioner? Yes, they are. But most of them are not adequately trained to work with adolescents and young people. So that knowledge gap exists, and because of that, you'll find out that there is this attitude or there's this stigma and discrimination by them when they see young people coming to obtain services like PrEP or maybe treatment, ARVs. So the solution for us has always been, we are advocating for Federal Ministry of Health to continue to make it a mandate to build capacity of these service providers on youth-friendly health services. And I'm happy. Federal Ministry are trying their best. In few states now we can see services have been integrated. RAMCA now have provided opportunity for even adolescent care to be part of what Primary Healthcare Development Agency provided, so that adolescent can go into PHC and obtain any services.
We work with National Human Rights Commission and the law enforcement agencies to ensure that the rights of individuals are protected. Individuals also are obligated to learn about our extant laws and see how they work within what is provided by the law. Every country, you find these existing laws that guide the implementation of programs wherever they are. Nigeria is not an exception. Nigeria has its existing laws. The law enforcement agents have responsibility. And then also the service providers also have responsibility. We are talking to all stakeholders that are involved to see how do we allow population at risk to access services when they needed it most. And how do we provide service provision points where they can access services with utmost privacy and confidentiality. And communities need to reciprocate also to make sure that where those services are provided, it is only the services that are accessed and no other extraneous activities.
The age of consent is a significant barrier influencing access to information, testing, and treatment of adolescents and young people. Addressing this issue is essential to ensure a collective effort towards ending the epidemic by 2030.
Nigeria is a country that has its own democratic system and also uphold its own rule of law. So we might be saying age of access. That's what we are pushing for now, because to get an age of consent change is like saying Nigeria should review its constitution as a country. So, but knowing that some of these things can take long process, a lot of effort have been getting towards reducing the age of access to 14 years, and which we are achieving some milestone. The Council on AIDS approved that for APIN, and we are waiting for the Council on Health to see what can be done. And we are happy that PEFA Liquid Equity Fund has been approved, and part of what the fund, despite being catalytic, is expected to support Nigeria for is to drive advocacy for age of access in the country.
We need that bold commitment, political leadership and commitment to remove those barriers that you're talking about, so age of consent can be an obstacle. You also need the inclusion and the participation at the community level. You need to get the role of the gatekeepers. We need also that engagement. So bold political leadership, science evidence, remove inequality. And then thirdly, making sure that the communities, that we empower the communities, and we support them such a way that those communities can play a role, and then allocate the necessary resources.
The age of consent is a work in progress. We are working on it, and we are looking at the laws, and we are looking at how do we provide access to services to people that deserve it and to people that are at risk, even though their age is lower than we expect. So we're working to see that individuals are protected and we don't go beyond what the law allows us to go. So we're working on that.
Leadership and participation are core human rights principles. When adolescents and young people get engaged meaningfully in the HIV response, they not only contribute actively, but are empowered to initiate and direct their own interventions.
Participation shows that Nigeria is doing well, but we need to improve. It's okay to say we have young people across different governance and also across different mechanisms. There is still a gap in terms of participation. There are still limitations because the level of participation is not at scale. There are states that might have resources and also prioritize the role of young people in what they do, but there are other states that doesn't also see it that way. So that's why I think participation also have a little gray area that needs improvement.
We are getting to see more young people getting into those leadership spaces, getting into those forums where they are able to amplify the issues of young people. But over the years, before now, youth-led organizations have not really been benefiting from the process. And that's because someone who was older than 35 was seated there as the youth representative with no accountability. So, I mean, it is quite very important to note that, first of all, the youths had to understand their value for that to happen. They knew they could be on that seat and not a 45-year-old person representing them. So it needs to start from that, getting your value, knowing your value, knowing what you can bring to the table. It's very important for people to then recognize you as a leader for a constituency. You need to show that. It's good that young people start showing that, and I'm excited that young people are doing that.
To some, recognizing adolescents and young adults as mere beneficiaries instead of partners is also a major barrier in achieving HIV epidemic control.
First of all, I think it's very important to note that youth-led organizations are doing great work. And it's also very good that you also value them as experts in their own fields. Recognizing them as experts in their own field is you trusting them with your technical resources to actually implement the work on their own. But so many times that has failed because young people, youth-led organizations are being seen as beneficiaries rather than partners. They understand these issues better than you. They know their peers better than you. They know how to get their peers to access such a program better than you. So I think it'll be quite very interesting to start seeing international partners. I know some international partners are already doing that, and we applaud them for that. But I think going forward, we'd like to see more of that happening, more of that, respectful partnership, with the same level of playing ground in a way that it's both benefiting both sides, both the youth-led entity and the international partner.
So I think the challenge is how do we reinvent ourselves? How do we create again that sense of urgency? How do we build the capacity, of those young people, in such a way that they can play a key role in the AIDS response? But I will argue that it shouldn't be something which is limited to the AIDS response. It should be integrated to see, because whether we like it or not, as we move forward, the vertical program will be difficult to survive. How do we build the capacity in an integrated manner in such a way that can look at sexual reproductive health and rights, political participation, you name it, and recreate that sense of urgency, create that space in the society. And I would want to say it's they can be more bold, and then fight for themselves.
The scorecard provides a summary for the Uproot process in 2022, highlighting challenges and recommendations identified by adolescents and young adults.
The report speaks to the different aspects of the work each of us do, whether law and policy, which has to do with government and policymakers, and whether the service delivery aspect, financing engagements, which has to also do with the IPs that we work with, or whether leadership, which has to do with our own members and our own fellow youth organization. So what we will just ask government to do is to look at this finding and make the deliberate commitment towards seeing the areas we have gaps, that they are addressed. The first time Uproot was called in Nigeria, the performance of Nigeria as a country wasn't good like this. But you can see by the time we had this second scoring, things have improved. And now we are also saying, with the recent finding, we are already doing good in some aspect. Let's sustain that gain we had. But areas at which we are totally underperforming, it's time for government and stakeholders, IPs, implementing partners, donors, including youth organizations like us, to sit down and see how do we bridge this gap before conducting another performance appraisal on Nigeria.
The truth about it is government work annually based on priorities. But I think what's most important is how do you ensure that your priority is in the government's agenda. So the only way you can do that, first of all, is by having data, which the Uproot Scorecard gives you. Now, after doing that, I think it's also very good that you're doing this work with the government, with the UCO, the UNS country office, or any other partner that has the influence to push certain issues to the government to ensure that your issue is what's being addressed right from the ideation phase, because when they know from the beginning, it's then easy to push your issues to their forefront because they were part of it. That way, maybe we could see more friendly laws, more friendly policies that, promote the rights and access to of young people, young key populations across the world to, accessing some of the services.
I think we're all happy and proud with the outcome of the Uproot Project in Nigeria, aiming at getting young people, so more involved in the response. We'll be more than happy to work with the team in APIN as a follow-up to the Uproot Project to see how we can develop evidence-based advocacy, help them to see how they can engage in terms of mapping, not only on HIV, but in their contribution to the entire social services. And then we need to find ways and innovation to get them more interested in.
NYP is a population, and we have several populations that access services for HIV, and we have people that provide those services. First of all, NYP need to provide access. We need to see them. We don't see them. So show yourself so that we provide you the services that we provide. All other communities, the key affected population, they show themselves. And we access them, we see them, we provide service to them. When you go to general hospitals, we see pregnant women that are coming to access our antenatal services, and we provide service to them. But where do I see adolescent and young person? There is an issue with connection. The group that want to work for adolescents and young person and the leadership need to do more. You need to tell us, how do we come together? How do we connect with your larger community, and where is the larger community located? The government effort is the same as seen everywhere. And there is this saying that says, nothing for me without me, as far as community is concerned. So adolescents and young person are a community, and there is nothing that will be done for them without them.
The Uproot Project, which aims to improve the health and well-being of adolescents and young people, have witnessed remarkable success. Young individuals taking charge, dismantling barriers.
The Uproot itself is changing the narratives. It's giving a voice to every population, because through the scorecard, we can hear the voices of the marginalized group, the vulnerable group, and the key population group. They're hearing their voices because they all agree, as I was saying, this is where the Nigerian government is in terms of ensuring that their health and well-being are respected and fulfilled. So, that was why Uproot came about, because it's not just your own perspective. You're using the perspective of others. You're comparing and you are coming to consensus to be like, oh, this is the reality of where we are in terms of what ending AIDS.
Uproot.
The report of the Uproot Project can be a veritable tool in achieving HIV epidemic control by 2030 if implemented.